I want to start this off just by giving a huge thank you to everyone that showed love and support on my last video. All the thoughts, prayers, kind words truly did mean a lot to me. Today, I have some pretty big updates that I want to get into, but before doing that, I want to give a quick recap on what's been going on the past few months, since it has been a while since my last video on here. As a lot of you probably already know, I've been battling leukemia for several years now. In 2022, I had a stem cell transplant that originally looked like it was successful. I was in complete remission for about a year before a little bit of disease became visible through a bone marrow biopsy. We monitored this for several months to determine whether it would continue to increase or if it would disappear or if it would maintain that low level. And as of this past March, it became evident that I had to do something because the disease level was rising. So the first response was to do some what they call light chemotherapy. Essentially, what I mean by that is it doesn't have a lot of the more intense side effects that are stereotypically associated with chemo, like feeling sick or losing all your hair. And the process went pretty smooth. As I said, no issues as far as side effects. The only real negative thing that comes along with that is it does still lower your immunity, lower your white blood count, which prevented me from being around crowds of people and socializing as I normally would. After that first cycle, it was about a month. It was evident that the chemo was pretty effective in lowering the level of leukemia that was appearing. Almost completely gone, but not quite. What I mean by that is it was like if you measure it in percentage of cells, it was at like 0.01. So like incredibly low, but just not quite fully gone. Now after that first cycle of chemo, I took a few weeks off of no treatment, which allowed me to go to a bunch of family events. I went to multiple weddings and really just was kind of able to get back into a sense of normalcy before starting the next cycle. What was evident though was that despite having gone to such a low number in between cycles of chemo, it was slowly starting to tick up again. And then after having done a second cycle and taking a little bit of time to watch, it was starting to go up again. So we're now at a place where we had to decide, what are we gonna do next? Because there were really two options and two approaches to this situation. One would be to continue doing this form of chemo or potentially a variation of this chemo where it would essentially be maintenance treatment, meaning that it would be done continuously over an extended period of time, basically just to keep the disease level at a low, manageable, and not threatening level. This has pros and cons. I mean, the pros would be it's not risky as far as, some form of intense treatments can be. You don't have the risk of really dangerous side effects, that sort of thing. And physically, I would be able to be feeling okay without going through very much pain or discomfort throughout the whole process. The downside, of course, is that the disease doesn't get destroyed. It doesn't get eliminated. It's still there at a low level. And this treatment, despite not necessarily having really bad side effects, it does still lower my immunity to a point where I can't exactly live the life I want to because of the fact that I can't go to school on a regular basis, go to work on a regular basis, exercise on a regular basis. It's incredibly difficult to get into any sort of routine when having to go through this level of treatment. So, spoiler alert, that's not what I decided to do. Instead, I'm planning on going for, I guess you could call it a knockout approach, trying to get rid of the cancer, get rid of the disease completely. And that is going to be done through a stem cell transplant, a second one. And the first one obviously didn't work, but sometimes people have a stem cell transplant, relapse, have a second one, and then they're good. My doctors do believe that this is the best course of action if I want to completely eliminate this disease and put it behind me and go forward with living a normal life. The process for this second transplant will be different than the first one. To get into that a little bit, for my first transplant, I had to go into the hospital for about a month and receive chemotherapy as a way to kind of get me in complete remission or as close to complete remission as possible. And then I came home for a couple weeks, and then I went back to the hospital where I received really high doses of more chemo plus radiation as a way to completely destroy my immune system. Then I received stem cells from a donor that were able to create a new immune system for me. That's the process. This time around, rather than doing that first initial month of chemo in the hospital, I'm going to be doing something called CAR T cell therapy. CAR T has been around for a few years, but it's relatively new, and this specific type of CAR T that I'm going to be getting is a brand new clinical trial designed for my specific variation of leukemia. I'm gonna be literally like the 5th or 6th patient that's doing this trial, but as far as the initial results so far, they're pretty happy with it and confident that this will be a good option for me. What CAR T is specifically is basically you take these cells and you engineer them in a way that they're able to identify this specific marker that's found on leukemia, and then the CAR T cells are able to see that marker on the cell and then go and kill it. I'm going to be receiving these CAR T cells in about 10 days, and I'm going to have to go into the hospital for that because, like I said, it is a new trial, so they need to monitor their patients to make sure, my head doesn't explode or anything. And then after those 2 weeks are up, I'll just come home and essentially monitor this process for the CAR T cells to kind of work and do their thing and eliminate as much of the leukemia as possible. It's about 4 to 8 weeks, so we want to make sure they have plenty of time to do what they're supposed to do and get me as close to, if not in full remission, before going into the transplant. Now, you might be wondering, as I did when I first heard about this, why I can't just do the CAR T as a standalone form of treatment and skip the transplant altogether, because the transplant is not the funnest process. And the reason for that is pretty interesting. Essentially, CAR T's been a thing for a bit, so there are some more established forms that have been proven to be long-term successful as standalone treatment. But because this is such a new early trial, they have no idea whether the effects would be successful long-term in keeping a patient in remission. And my doctors aren't necessarily confident that that would be the case. So instead, we're doing CAR T as basically a substitution to chemo leading up to the transplant, as a way to get me in remission going into the transplant. And also, it could potentially be even more effective than chemo. It also has less toxicity, which is an added benefit as far as my overall health. So yeah, as of right now, that's the plan. In about 10 days or so, I'm gonna go into the hospital for receiving the CAR T. Gonna stay in there for them to monitor me for about 2 weeks or so, because like I said, I wanna make sure I don't explode or anything. Then once I get out of the hospital, I'm gonna be home kind of just monitoring for a while, about 2 months or so, to make sure that it does everything it needs to do. And then assuming that it does, I will then move into the transplant, most likely around November. For the transplant itself, I'll have to go into the hospital for around a month. If everything goes okay, then I'll be able to come home once that month is over. And then it's just a matter of recovering and monitoring to make sure that the leukemia is gone. And hopefully this time, God willing, stays gone. So all in all, it's going to be a very interesting next few months to wrap up 2024. But I am going to try to do a better job of staying on top of YouTube, because I do want to make more videos and try to document more of my story as I go through this process, because I think it could get pretty interesting. We'll see. Hopefully not too crazy though. But yeah, so hopefully be back on here soon with more videos about what's going on with CAR T and how that process goes. But until then, I do appreciate, once again, all the love and support and all the kind words that have been shown to me on here. I hope that you all have a great rest of your day.